Hello, this is Kayla Baldwin, and this is my final presentation for this class. Today, my final presentation is going to be on compartment syndrome, which is actually really interesting to me, so I'm glad I picked this, and here are some notes that I'll be reading off of. So, when I first started learning about compartment syndrome, I was actually playing a video game, and one of the characters unfortunately had her arm crushed, and later it was determined that she had compartment syndrome. And throughout the game, as her arm was getting worse, it was turning red, looked really swollen, and basically it was from like here to here. And unfortunately, she had to get it amputated. And by the way, it was a survival game, so if she didn't have that procedure, she would have died. It's unfortunate, but that was the first time I ever heard of compartment syndrome and actually saw what it looked like, I guess, animated. But anyway, so compartment syndrome is a condition where increased pressure within a closed muscle compartment reduces blood flow, leading to ischemia and potentially tissue damage. So again, as I mentioned in the game, so when her arm was crushed, it was crushed by a hammer. Yeah, it's a fighting game slash survival game, so sorry if it's a little graphic. But yes, her arm started to turn red because her bones were pretty much crushed into that closed space within her arm. And 9 times out of 10, that person will need some type of surgical emergency treatment. So now for the classification of a disease, acute compartment syndrome, or ACS, is often caused by trauma or fractures. It develops rapidly and requires immediate intervention, or else the arm will not be any good or wherever the injury has taken place. Chronic exertional compartment syndrome, or CECS, is caused by repetitive exercise or physical activity, and it develops gradually and will resolve with rest. Etiology is caused by fractures, aka trauma to that particular area, soft tissue injuries, crush injuries or burns. Tight casts and tight bandages and tight splints can also cause compartment syndrome, unfortunately. And overdoing it with the exercise could lead to chronic compartment syndrome. All right, some clinical manifestations of compartment syndrome is that you have severe swelling, unrelenting pain. Even though if you take pain medicine, it will not take the pain away, because again, this is a fracture that is in a closed space. So as you try to move it or even try to rest, it's gonna hurt. The pain will worsen unless there's some medical intervention. Some signs, there are 6 signs that I included in my notes. You have pain, tingling slash numbness, pallor, pale skin, paralysis. That person will most likely be sweating profusely. There will be cool in temperature, which was kind of surprising to me because usually when there's a problem area, most of the time that area is warm to the touch, or at least warmer than other parts of the body. So hearing that that limb will be cold was actually pretty cool. Some diagnostic tests would consist of compartment pressure measurement. A catheter device is inserted into that area to measure the intramuscular pressure. Now we have differential diagnosis, which is some similar symptoms of swelling and pain. Differential using venous Doppler ultrasound, which would confirm the pressure of a clot in DVT, but not in compartment syndrome. Some complications, which most of the time there might be some complications with any type of procedure, anything this serious. The muscle, you might have muscle necrosis, which is where there's permanent damage to that muscle, where the muscles die in that area if it's not taken care of. You have nerve damage, which causes chronic pain or functional impairment of that area that has been injured. Amputation, which again, that's exactly what happened in the game. She had to get that arm amputated. And that's in severe, no choice cases. And then lastly, Rhabdomyolysis, which is muscle breakdown, releases toxins that may lead to kidney damage and eventually death. So that is the end of my final presentation for pathophysiology. Thank you again, and this was a really fun topic to discuss. Have a good one.